Okay, thanks everyone for listening to me today, giving me some time. My name is Katie Hudson and I'm a family counsellor at Lives Lived Well. I just first of all like to acknowledge and pay my respects to the traditional custodians of the different lands of which we're meeting today. In Metro South, I go around to a lot of areas. So these people include the Turrbal, Yugamba, Jagera, Mananjali and Quandamuka people. So today I just wanted to focus in on our family support group, Breakthrough for Families. I just also wanted to say thank you to Natasha and just to acknowledge the wonderful things that FDS does in this space. We work alongside with them in supporting families, but FDS does amazing things, and I refer a lot of my clients onto FDS for ongoing support after they leave me to their peer group sessions around Brisbane. So they're awesome. So what is Breakthrough for Families? Well, we're a statewide program that's delivered by Lives Live Well. Basically, we're teams of professional family counsellors. We're based in Brisbane, North and South, Sunshine Coast, Townsville and Cairns. And we also support families who are impacted or concerned about a loved one's substance use. We work through Lives Live Well, and Lives Live Well is a non-for-profit organisation throughout Queensland and in New South Wales now as well. It supports people with substance use issues, and it offers a variety of different alcohol and drug treatments and mental health support. So basically we have a Lives Live Well office, Brisbane South team at Beenleigh. So we're in George Street in Beenleigh, and we also have a Beaudesert office in Brisbane Street there. On the south side, we have also many offices on the north side, but today I just wanted to concentrate on our Beenleigh space. So in our Beenleigh space, we offer free drug and alcohol counselling, as well as drug and alcohol group programs, including Smart Recovery, both of which are free. We have a residential rehab at Chambers Flats, which is about 20 minutes from Beenleigh, called Logan House. And we also have a day rehab centre at Woolloongabba, which started just about 9 months ago. That's a free service. So that's for people who are wanting an alternative to residential rehab, that might just want to go to like a daily option. And then we have the family support program, Breakthrough for Families, which I work on. This incorporates free individual family counselling. So I see people face to face in our Beenleigh office in Beaudesert and Woolloongabba, as well as the north side. Also, I can offer virtual appointments and phone appointments, just based on what the client wants, really. And also we do the free information sessions for families. So I'll talk a little bit more about that in a minute, but we're offering those twice weekly via webinar at the moment. Beforehand, it's been in the community. As we move out of COVID, we'll probably do community sessions and continue our webinar. So who are the kinds of clients that a family counsellor will see? Well, I might be working with a person who is impacted by a partner's alcohol or drug use. Sometimes I see many parents who have a son or daughter who is engaging in problem substance use. I have many grandparents who are clients of mine who may be, for example, the primary carer of their grandchild, but have a son or a daughter who's impacted by drug and alcohol use. We can see young people from the age of 12 up. So I see teens, adolescents who might have a parent with problematic substance use. And I also even see adults who have just experienced a lot of childhood trauma themselves, if they've been sort of growing up and living with a parent with alcohol and drug dependency. So what family is a range of different relationship types. And also, of course, as Natasha mentioned, family can incorporate anyone who cares, including friends. So sometimes friends, people who have a friend who has got a dependency, they'll come and see me as well. So our family information sessions are a good place to start. We often recommend them before people come into family counselling. do a 2-hour session. So at the moment in the webinar, we're delivering 2 1-hour sessions, and they cover a variety of topics, such as exploring underlying reasons why people use substance use. So when I meet families for the first time, they're very often, the alcohol and drug issue is front of mind, understandably. We like to then sort of unpack that a bit and explore what are some of the underlying reasons why your loved one might be using. So, is it to deal with a mental health issue? Is it based on some social isolation? Is it some trauma? Is it managing physical pain? There could be lots of reasons why a person has begun to use or continues to use problematically. And when a parent or a family member understands a little bit more about the underlying reasons, an interesting thing happens. They sometimes lose a bit of their anger and sort of open their hearts and become a bit more, take a more compassionate stand. And family therapy, that's a good place to start. Also, we talk about the interconnection between mental health and alcohol and drug issues, which are very interlinked. We talk about harm minimisation. So if your loved one is not wanting to change their substance use at this point in time, what are some ways you can help them stay as healthy and safe as possible whilst they're continuing to use? We talk about communication strategies, how to, for example, effectively open up honest and non-judgmental conversations about the substance use issues with your loved one. Can be tricky to do, but we talk about a few tips that can sometimes help, as well as how to manage conflict in relationships and in the family home, of which sometimes there's quite a bit. Talk about establishing boundaries, and I think Natasha mentioned this in her presentation, how to, often family members feel a bit powerless. They feel like they're walking on eggshells around their loved one, even when chaos is going on. And this is not really an effective long-term strategy for themselves as well as their loved ones. So we talk about how to establish that. And then we give an overview of the different alcohol and drug treatments, for example, that Lives Live Well can offer, as well as other alcohol and drug support agencies in the community. We talk about how to respond to challenging behaviour, such as escalating mental health situations, as well as, for example, perhaps violence when a young person, such as a son or daughter, might be using. So how to manage these kinds of things. Safety planning for your loved one, as well as other family members and yourself. We also talk a bit about maximising the wellbeing of children, if there are children in the home front when some substance use is going on. And just self-care for themselves. Often when we meet families, they are burnt out because they've been struggling with this for a long time. The petrol tank is empty. They need to start looking after themselves as much as, or even more so than their loved one who's using. So we really talk through this kind of thing. This is just a couple of slides I brought out from the information sessions, just as a bit of a sort of indicator of what things we might cover. So we talk about how when there's problem substance use, you can be on a very different page to your loved one who's using. So for example, say if in the context of a partner, partner might think, oh, you're not thinking about our children, whereas the partner who's using thinks my kids are everything to me, but sometimes I hate myself as a parent. One person thinks you don't care about, you're keeping your job, with your drug use. Person who's using says, I'm overwhelmed by work and the drug calms me down. Person thinks, if you loved me, you would just stop. Other person says, well, I love you, but I don't want to lose you, but you don't understand how hard it is for me to stop. So often we're on a very different page from our loved one. And that's important to kind of recognise. We talk about the stages of change. Natasha was mentioning about the stages of change that families can go through. This is we also talk about, stages of changes that a person who is using alcohol and drugs will go through. And based on where they are at, as in your person, we talk about some effective strategies to support them. And it's really about following your loved one, so where they are at first. So for example, if they're in the not yet phase, the pre-contemplation, they don't want to change their substance use, what are some things you can do to support them? Well, it's about beginning some open, non-judgmental conversations with them, thinking about harm minimisation and communicating to them about that to keep them as safe as possible. That would be one way to support. When they are about having a go, when they're doing action around their substance use, you can support them in a different way. So it might be, supporting them by recognising small changes that they're making to their substance use. We remind families that substance use change often takes a length of time. It doesn't happen overnight. So there's a degree of patience that's sort of required. So there are different strategies that family members can adopt based on where the person is at in terms of their substance use change. We also give some advice about supporting young children in the home if there's problem substance use. So, for example, having an honest conversation about what's going on, but making sure it's age appropriate. Listening to how a child feels and reinforcing that they're not to blame. Often small children feel like any problem in the family is because they've been a bad boy or a bad girl, because they're in an egocentric phase of their life. So we really emphasise how important it is to assure children that they're not to blame. Identifying other safe adults outside of the family home that they can immediately sort of call, or that they can see easily to get things off their chest, because often they don't want to talk to mummy about it if it's happening in their family home, because they know how upset mummy can get about it when they bring up this topic. Assessing for any risks in the home. Is there any drugs that they can get their hands on, any drug paraphernalia, things like that. And amidst the chaos, children benefit from really healthy routines and time spent with people who care about them. So how to maximise their well-being whilst there's a bit of chaos going on. We talk about the different treatment options, of which there are many, and rehab is not for everyone. There's not a one-size-fits-all. So we talk about, for example, at Lives Live Well, the different alcohol and drug treatments we offer, such as the counselling. What is alcohol and drug counselling? What does it involve? Detox and withdrawal, which is not a treatment in itself, but needs to be followed up by either counselling or rehab. We talk about our rehab services, so the difference between residential rehab and day rehab. Some people prefer one or over the other. We talk about peer support groups, how they can help a person move on, and pharmacological treatments as well. So we go through those different examples. And I think the great thing about our service is we provide at Lives Live Well a wraparound service. So we have the family support, but we also have our alcohol and drug teams working alongside us. And what often can happen is that a client might be in an alcohol and drug treatment program, and then their loved ones will engage with us whilst their loved one is getting alcohol and drug treatment, which is a wonderful time for families to be getting informed about how they can continue to support their loved one well after they've left a Lives Live Well rehab. So it works harmoniously, often very well. And sometimes I'll see family members, they'll first and their loved one hasn't engaged, that's fine. Their family members will go home and talk to them about Breakthrough for Families and what they talked about, and that can sometimes pique the interest of their loved one, who might then engage with Lives Live Well for their own support. So it's a beautiful kind of wraparound service. We also offer an Aboriginal and Torres Strait Islander yarning circle, which has been developed by the Queensland Aboriginal Islander Health Council and Apuna Pima. We've gone out to Aboriginal communities in different parts of Queensland and talked to them about the strengths that they have in terms of managing alcohol and drug situations in their community. Many strengths there. And we also reach out to First Nation family workers to see if they'd like to use our material with groups that they work with. So to refer, basically really easy. Family members can just call our 1300 number, Lives Live Well. You don't need any GP referral or anything like that for family support or for alcohol and drug support at Lives Live Well. You can also go to our website to refer. You can contact me directly. I invite workers or any family members if they want to ask me questions or refer themselves on my number or my email. We also have a specific Breakthrough for Families email that you can contact. And we prefer individuals to self-refer, but workers can refer on behalf of an individual if they have the consent, verbal consent of that individual to have their details passed on. So that's it in a nutshell. Just some feedback from some of our BFF Breakthrough for Family clients, which is nice to hear. I won't read them out. You can just have a look at the slide. Okay, and yeah, thank you very much. If you have any questions, happy to answer any.
Thank you for that, Katie. Much appreciated. Lives Live Well is a fine organisation, and me working for BDCDA, we've operated in the neighbourhood centre in Beenleigh. We've referred many clients up to your Beenleigh office, and we've only ever received positive feedback. So we appreciate the excellent work that you do.
Thank you. Thanks very much.
That's okay. We haven't had any questions come through, but you have provided your contact details, haven't you?
Yes.
Yep. And I'm going to send all the details around after the webinar anyway, so
Awesome.
people will get in touch if they need to.
Great. Thanks, Anthony.
All right. Thanks, Katie.